Thank you, Acting President, and I thank Ms Crozier for bringing this motion to the attention of the chamber. The alleged misrepresentation and falsification of data at Northern Hospital relating to the time patients spend waiting to be offloaded from an ambulance into the hospital's emergency department. Now, claims that data has been falsified to meet statewide targets for ambulances to transfer 90% of patients to hospital staff within 40 minutes. And apparently it's been happening since 2017, with times adjusted by up to an hour. Now, the falsification and manipulation of recording data has extremely serious implications for the integrity of data and public confidence in our health system. I mean, can we rely on this data? Are other hospitals doing the same thing, feeling the pressure to meet targets? Are waiting times far worse than the data shows? Now, the Northern Hospital is just outside the Northern Victoria electorate, but would certainly service many residents living in the region, such as Plenty and Yarrambat and Mernda. Northern Victoria is a very large electorate that spans from Mildura right across to Corryong down to the outskirts of Melbourne, and across Northern Victoria people are waiting too long for ambulances, too long in emergency departments and too long for surgery. Hospitals are full, staff are exhausted and regional patients are getting left behind. Now, you look at our health system, there's a shortage of hospital beds, particularly in regional areas like Mildura and Wodonga, which does contribute to ambulance ramping. Now, my Nationals colleague Jade Benham has certainly raised these issues and concerns about the state of emergency care at the Mildura base public hospital. And the Minister's recent announcement of just 4 subacute beds is not a solution for the overwhelming pressure being faced by frontline staff and emergency departments. Now, Mildura Hospital recently experienced a 48-hour code yellow, meaning there were no available beds and patients were left waiting far too long for care. And just last week, The Age reported that Mildura is now the worst hospital in Victoria for emergency department waits. Now, this is not acceptable, and the Minister really does need to urgently outline a long-term plan. But in Wodonga and Albury, the situation is just as critical. And I know local residents are frustrated that the Labor government has reneged on their promise to build a new hospital for the rapidly growing region. Now, I've received a copy of a submission from the Indigo Shire Council and Towong Shire to the Ambulance Victoria inquiry, and it outlines some of the concerns. It says, "We plea in desperation, our regional health services in decline. Our key concerns are on 2 fronts. The Albury-Wodonga Health Service is in crisis. The Albury-based hospital struggles with a bed shortage of 40 to 60 beds every day. Just last week, a code yellow was declared, meaning the health service had reached its capacity and all acute beds in the wards and emergency department are full, not a rare occurrence. The Victorian and New South Wales state governments are pushing ahead with an upgrade to the existing hospital on the existing site when the clear advice of the medical professionals and a 2021 clinical services plan is that a new hospital on a greenfield is required. The current plans for the hospital will not address the bed shortage in the longer term." It goes on to say the ambulance response times for Indigo and Towong for Q3 2024-25, Code 1 first response, were the worst and second worst in the state respectively. This disappointing result is not new. Our concerns have been expressed with the relevant ministers since 2019. In fact, the results for both councils have deteriorated over that time. Now, it goes on to say the 2 issues are linked. The existing hospitals in Albury and Wodonga are not fit for purpose, operating with limited capacity and struggling with inefficiencies due to their split campus model. It says, in the context of Indigo and Towong councils, this is significantly impacting our poor ambulance response times. It is no coincidence that they are the lowest in the state. The dual impact of long ambulance response times combined with a health service running beyond capacity can only be a deadly cocktail. Now, I've spoken with staff who start each shift at that hospital facing ambulance ramping and a significant shortage of hospital beds. Now, locals are growing tired of raising the issues and being ignored as the state government ploughs ahead to redevelop the existing site with a master plan that fails to meet current needs, let alone future demands. Now, precious time is wasted searching for beds rather than caring for a patient, and this is not good for patients or for paramedics. For our paramedics, it means longer longer shifts. And I received another email recently after there was an update from Better Border Health, and it talked about, it says, we have been alerted to the fact that an elderly patient this week spent all night in an intensive care vehicle ramped at Albury Hospital. That night the temperature dropped to as low as 2.4 degrees in the early hours of the morning. And it goes on to say another consequence was that the paramedics missed both their breaks and had to work beyond the end of their rostered 12-hour, 15-minute shift by another 30 minutes. We're sharing this story to highlight that the risk to the community is high and will continue if this redevelopment of Albury Hospital continues with no extra beds for 4 to 5 years. Now, ambulance ramping is happening right across Victoria. Now, just recently, the Victorian Ambulance Union Secretary Danny Hill gave evidence to the parliamentary inquiry that ambulances in Bendigo had been ramped for 7 to 8 hours and that an elderly man who had fallen waited 9 hours for an ambulance. Now, the parliamentary inquiry is currently underway. There's another public hearing, I know, on Friday. And it's certainly looking at a range of issues. Now, I know often the website might say that submissions are closed, but because hearings are still underway, I do encourage people to contact the committee secretariat if they do have a story to share and would like to make a submission to that inquiry. But these stories I hear regularly, speaking to people in my community, and they reflect the real consequences of a health system that's at breaking point. We need more hospital beds in regional Victoria to service the growing population. Our hard-working paramedics need hospitals that allow them to get off the ramp and get out and back and look after patients. Now, Ms Terpstra talked about this motion calling for an inquiry. This motion doesn't do that at all, but the Nationals do support this motion because it goes to the heart of the need for reliable data in our health system, and it calls on the Allen Labor government to appoint an external and independent health expert to review processes relating to the collection of data on ambulance transfer times in public health emergency departments. Thank you.
Thank you, Mrs Broad.
Thank you very much. And our next speaker is Mr Berger.